So laser vision correction is a way that we can reduce your dependence on glasses. LASIK is one of those types of procedures that we can do, and it involves a 2-laser system. And the first laser is used to cut a perfect circle flap in that cornea. And then we lift up that flap and use the second laser to essentially take your glasses prescription and etch it into the cornea. And then we put that flap back down. And the benefit of LASIK is the visual recovery is very short. You'll walk out knowing that the vision's better, and then it just continues to get better in the next couple of days because all the work is done underneath that flap. So as soon as we replace that flap, you'll start to feel pretty encouraged about the vision. Now, the alternative to LASIK is a procedure called PRK. It stands for photorefractive keratectomy. And with that procedure, we don't do a flap at all. We just brush off the surface and epithelial cells. And then we use that same LASIK laser to etch that glasses prescription into the cornea. But then we have to wait for those surface cells to grow back. And as those surface cells grow back, that vision slowly gets better and better. And so the visual recovery is a lot longer. Now, a lot of times people will ask, well, which one's better? Well, the outcome's gonna be the same. It doesn't matter which one we choose. We're gonna end up at the same point, but it's gonna be a little different path on getting there. Now, which one should we choose? Which one's best for you? Well, a lot of factors go into that. It sometimes can be a patient preference. Patients may walk in and say, you know what, my brother had LASIK, my uncle had LASIK, I want to have LASIK, and so it can be a patient preference. Or same thing with PRK. Patients may walk in requesting to have PRK. Sometimes it can be medical reasons on why we'd want to choose one versus the other. For example, if your cornea is too thin, there may not be enough room to cut that flap and do the treatment and still have enough residual tissue to maintain the structural integrity of that cornea. And so you might be a better candidate for PRK where we don't have to do that flap. So there can be medical reasons on why we'd want to choose one versus the other. Another common one is dry eyes. So LASIK, we know, will induce some dry eye versus PRK is less common to lead to dry eye problems.